Welcome to Physio News Network, your trusted source for the latest evidence-based updates in physical therapy and rehabilitation. I am Girish Srinivasan, registered physiotherapist, bringing you research that moves the needle in patient care. Let's dive into today's headlines. First, we're going to talk about research reviews. Remember, as promised, 2 research reviews every PNN news broadcast. Number 1 research review, blood flow restriction training post-ACL surgeries. We begin with new findings on a popular rehab method, blood flow restriction training. If you haven't heard that before, you can Google and check it out. A recent study aimed to determine if blood flow restriction training could enhance quadriceps recovery post-ACL reconstruction surgery compared to standard rehab. Surprisingly, the results showed no significant advantage. There were no notable differences in muscle strength, architecture, or cellular level changes. While BFRT remains a useful tool in scenarios where high loading training is not possible, in this post-ACL population, standard rehab stood its ground. Yeah, you can definitely use it when people cannot do heavy resistance. That's definitely there is use for BFRT. So, for clinicians, keep BFRT in your toolbox, but do not expect it to outperform traditional methods in every case. Then, moving on to second research review. We're going to talk about tendon strain in Achilles tendinopathy exercises. This is a fresh look at Achilles tendinopathy rehab and actual tendon strain caused by common exercises. So this new research ranked exercises based on how much tendon strain they generate. The big takeaway, walking can be enough stimulus for some of the patients. Bilateral hopping can create too much strain for certain phases of recovery. And the contribution of each triceps surae muscles, which is all the 3 muscles in your calf, that is your medial gastroc, lateral gastroc, and also your soleus muscles. It's together called as triceps surae muscles. The contribution of each triceps surae muscles alters strain across 3 Achilles subtendons. It's not just one tendon you're dealing with there. This gives physios a better roadmap, matching exercises not just to pain, but to the actual mechanical loading needed for the tissue adaptation. So those are the 2 research reviews for our PNN news today. We are moving on to clinical practice guideline. In the clinical guideline, we're going to talk about Cauda Equina syndrome, CES. It is a clinical emergency that must not be missed. Cauda Equina syndrome creates a lot of red flags and you have to pick it up. Saddle numbness, bowel bladder changes, bilateral radicular pain or leg pain in both sides. These are sometimes patients present with this with the lower back pain. So as a physiotherapist, we have to look for these red flags and rule these out. A systemic review confirms an urgent MRI is essential when these red flags are present. Delaying an MRI and delaying the diagnosis, which can lead to permanent bowel and bladder dysfunction. So it is a real emergency. So if CES is suspected, screen quickly and refer immediately because time is fine. Then we move on to our exercise segment. What exercise we're going to talk about today? It is your Nordic Hamstring Curls, a gold standard in hamstring injury prevention. It is proven this one exercise prevents 60% of hamstring injuries. So this eccentric focus movement builds resilience in the hamstrings, particularly reducing risk of strain in athletes and runners. So what's the tips for clinicians? Starts with assistance like resistance bands or partial range, then progress to full body weight as tolerated. Always emphasize control lowering of the trunk. So the best rehab is prehab, and this one exercise earns its place in any athletic program you are participating. Next, moving on to innovation. Today's innovation spotlight is on intermittent pneumatic compression device. This device is beyond managing edema. New research supports its therapeutic role in enhancing venous return, reducing delayed onset muscle soreness, and also improving lymphatic drainage and supporting early mobilization in the post-op or post-surgical scenarios. So for post-surgical or sedentary patients, this could be a powerful adjunct to your rehab toolkit. You can always use this in sports recovery and also surgical recovery. And then moving on to our success story. Today's success story is going to talk about the software engineer we saw with cervicogenic dizziness. Most of the times we get a referral to a physio clinic thinking it's a vertigo or BPPV. When you do a thorough examination, more often than not, we find out your dizziness is coming from your upper neck rather than your inner ear. So a good vestibular assessment can find that out. So I met this software engineer who was sidelined by cervicogenic dizziness. His work and life was suffering a lot, and so was his confidence. Through a combination of good assessment, good listening, good subjective examination, manual therapy, especially to the neck area, soft tissue work, and joint work, proper cervicogenic dizziness management, including specific exercises for the neck, and postural re-education, he made a full recovery in just 4 visits, all guided by our evidence-based physio care. He's now back to Cauda with better posture and no dizziness at all. This software engineer story is a reminder: a personalized care grounded in research changes lives. If you have dizziness, don't think it's always your inner ear, it can be of your upper neck too. Do not go door to door with different health professionals to find out what is going on. Just go to a cervicogenic dizziness expert or a vestibular therapist to find out and start your treatments right away. You won't believe it. I've seen people who suffered from this for 2 years before they came to our door. So that's all for this edition of Physio News Network. Stay curious, stay evidence-based, and we will see you next time.